right, so now here we go. How appropriate. Today is World Plastic Surgery Day. We're here in Louisville, Kentucky, and we're exchanging ideas about facelift surgery, deep neck lift surgery. I'm so happy to be able to exchange these ideas with two of the leading plastic surgeons from Europe. Friends of mine from travels. We have from Belarus, we have Dmitry Batiukov, we have from the Czech Republic, from Prague, we have Petros Christodoulou, who is leading plastic surgeons. So we have been explaining to each other our ideas, exchanging ideas, and trying to develop ways to make better jawlines, better necks, better faces, the nuances. How appropriate is this for World Plastic Surgery Day? So Dmitry, Petros, welcome to Louisville, Kentucky. So tell me, how has your visit been so far? You've been in America, you've been visiting very good plastic surgeons.
We are overwhelmed with the results. So we expected something, but it's even more. So your experience is well known, and so that's why we decided to visit you. And I'm very thankful that you just answered the private message on the phone and told us, yes, you may come. So that was it. And that's why we try to use this opportunity to not only communicate in the surgical unit, in the OR, but also to make friends, to have to exchange the ideas in life and so on. That was a nice time for us. But mainly we were, of course, for the surgery, because Dr. O'Daniel is known in our part of the world as one of the most experienced surgeons in the facial rejuvenation. And particularly what was my point of interest is the versatility, the nuances, the details he puts in all his surgical planning and then implementation, and this is case dependent. And I would like to ask you, what do you call this? Yes, yeah, they are known like very many fancy names, and you call this O'Daniel method, yeah?
The O'Daniel method is the method I use to call it the Dmitry lift or the Kara lift, the Petros lift. So it's customized to each person, so it's hard to put a name on it.
Okay.
So whoever the patient's name is, that's their surgery, that's their operation.
Yeah, so but this name, even if it's one name, Dr. O'Daniel, is so many different techniques, and really they're customized to each patient. That's what we've seen in these 3 days, watching you, observing you in the OR.
You're too kind with your words. Petros, tell me, you do a lot of deep neck lift surgery, so what do you think about our new ideas for gland reduction?
So it's a very controversial type of surgery, as we all know. Not many surgeons do it, and I think I totally agree with your teaching and your philosophy that without reducing the excess volume in the neck, it's almost impossible to get the sort of results that our patients are looking for. You can get good results, but when the patient is looking for the absolute best, there is only so much you can do. You have to reduce the glands. And now you're getting into a territory that is a bit more dangerous than the casual neck lift, and you're getting into an anatomical area that is surrounded with various structures that you need to protect during the surgery, and you need to know your anatomy very well, and you are the best at that. You are your knowledge of anatomy is extreme, I think. And then you have the risk of bleeding and possibly other complications when reducing the gland, and you need to know exactly what you are doing. And this is one of the reasons why we came here, because I believe, correct me if I'm wrong, I think you have the most submandibular gland reductions as a facial aesthetic plastic surgeon in the world. So you have the most experience with this, and we came to see what are you doing differently. I know you're talking about your 7-point plan, which is a plan that increases safety during submandibular gland reduction. So we came to see you doing it practically because we want safer surgery for our patients. We want to give them the best possible result, and we want it to be as safe as possible.